I was actually born and raised in Wichita. My mom actually moved up from San Antonio since my grandfather was with the Air Force. Met my dad at Wichita State, and when they got married, they actually never moved out. So I did all my schooling here in Kansas, both undergrad, master's, and med school, including residency. Actually, I've never lived out of the state of Kansas. Wichita is my hometown. My initial major in college was electrical engineering, and for me it was okay going in. I actually didn't like a lot of the classes just because there was just a part missing. And so my husband and I were actually dating at the time, and I had a discussion with him. He's like, what have you always wanted to do? I said, well, I thought about med school, but I had actually a fear of blood. I'd actually almost faint at the sight of it. So being the awesome guy that he is, he goes, let's go get a job in the hospital, see if you like being around sick people. So I actually started, delivering trays and things like that. And it was more hands-on. It was called hospitality, and that was in Via Christi. We liked it. We stayed there for a year. Then he said, well, what's your next fear? So I'm still afraid of blood. He goes, well, let's go learn how to draw blood and overcome your fear. So we both became phlebotomists, and that's actually how we worked the rest of the way through college and grad school. So it was at that point where I went from just a biology major to actually being pre-med. I actually decided I wanted to do more of traditional medicine, internal medicine, where I can see my patients from the clinic to the hospital and so on and so forth. Working in a bigger hospital in Wichita, it was fun. I enjoyed my residency. I think I got excellent training. However, you only see a piece of the whole story when you're dealing with a patient. You only see a patient for 3 or 4 days when they're in the hospital, not their whole year and a half, 2 years after they've established with you. So that does impact the type of care that you can give a patient. So that's when I decided I wanted to do traditional practice for internal medicine. When we started looking around for opportunities, we looked at a couple of small towns. But one thing that we wanted to do was to stay close to Wichita, because that's where most of my family is, and that is where most of our friends are. So that was important. But also, we really liked Winfield because it has an active community. Also, it's a good medical community. I think that the hospital is actually very for patient care, very proactive. So that's the reason why we moved down here. Really neat is to be able to treat patients and to get down to a reason as to why. That's the biggest reason. You can treat symptoms day in and day out, but unless you get down to the why, all that's irrelevant.